So, inflammation, how does it work? Well, it could be from any kind of infectious or non-infectious tissue damage. In this case, we're showing MRSA, a MRSA infection, breaching the skin, causing tissue damage. Well, when these cells are damaged, so tissue damage here release things called phospholipids that make up the cell membrane. These are then broken down by an enzyme called phospholipase A2 into this one fatty acid called arachidonic acid. Arachidonic acid is then converted into these substances called leukotrienes by an enzyme called lipoxygenase, and these other substances, prostaglandins and thromboxanes, by this enzyme called cyclooxygenase. There's two types, COX-1 and COX-2. So what happens now? Well, leukotrienes and prostaglandins, along with histamine, which is released from mast cells, lead to these vascular changes. So vasodilation, so increasing blood flow to the area, and then increased capillary permeability, which allows things to move out of the capillaries. So that's what we have here. Why do we do this? Well, there's white blood cells called monocytes and neutrophils. These are the white blood cells that will munch up all those bacteria, clean up all kinds of cellular debris and junk and foreign material. So we're going to squeeze through these spaces because the endothelial cells are going to contract, and that's what increases the permeability. They squeeze through. Normally they can't do that. They're going to munch up all that MRSA bacteria, clean up cellular debris. All right. So what causes the signs of inflammation? So someone is spraining their ankle, it's warm, it's red, it's swollen, it hurts. Well, the swelling, that's because of the increased permeability. So we make these spaces bigger for the white blood cells to squeeze through. Well, water's going to leave as well. What about the redness and warmth? Well, vasodilation, more blood goes to the area, so it's going to be more red and it's going to be more warm. All right, so how do we block inflammation with pharmacology? Well, corticosteroids, you might have heard of these like prednisone, or injectable corticosteroids like triamcinolone or dexamethasone. They're going to block, they have many effects, but they're going to block the phospholipase A2 enzyme, which is going to decrease the production of leukotrienes and prostaglandins, hence less vascular changes, hence less erythema, warmth, and edema. The problem with corticosteroids, they have lots of side effects. So not only do they block inflammation and provide some immunosuppression, they also cause the liver to release glucose by a couple of different mechanisms. So it can lead to hyperglycemia. This leads to insulin resistance and potentially overt type 2 diabetes over time. So they're catabolic hormones. They're going to break down muscle tissue and bone. They can lead to muscle wasting and even weakening the bones or even osteoporosis. And then there's psychiatric changes, fluid retention, many other side effects. So because those had so many side effects and we couldn't use them long term, we came up with NSAIDs, non-steroidal anti-inflammatory drugs. Why non-steroidal? Because they're not corticosteroids. Corticosteroids are actually steroid hormones derived from cholesterol. So what do these NSAIDs do? They don't block phospholipase A2, they just block these COX-1 and COX-2 enzymes, so we have less prostaglandin production and less of this other thing called thromboxanes. So we don't have all the side effects of corticosteroids, like all the glucose release and insulin resistance and muscle wasting and all the breakdown from these catabolic hormones. So NSAIDs will decrease prostaglandin formation, so we'll have less inflammation. Now, the downsides of NSAIDs. Well, these prostaglandins have millions of effects in the body. Maybe not millions, but a lot. And two of them are protecting the stomach lining and protecting the kidneys. So you hear about people getting ulcers and gastritis and pain in the stomach. It's because we're blocking specific prostaglandins that protect the stomach, along with the ones that cause the vascular changes to decrease inflammation. Also, they're renal protective. Well, guess what? Overuse of NSAIDs can actually damage your kidneys, cause acute kidney injury, and even lead to chronic kidney disease, because certain prostaglandins protect your kidneys. Now, lastly, thromboxanes. What do these things do? Well, these things help with blood clotting and stimulating platelet aggregation. So we're going to have less of that. So that's why NSAIDs need stop before surgery, because this can increase bleeding time. Hopefully that helps.